What happens when the systems that are put in place to help become a part of the problem? And why are so many community heroes forced to hang up their capes in the name of sanity? Hi, my name is Jakari Earl. I went from receiving services to providing the service. I went from having case management to writing case notes. And I went from seeing faulty systems and wanting to be a part of the solution to experiencing burnout firsthand. Today, I'll be interviewing two community workers with over 20 years of experience across 4 industries, one of which being a former co-worker in nonprofit and the other being a former peer from community health work class. We'll tackle the topic of burnout systems in Chicago, how it affects those receiving and providing services, and what we can do as service providers to combat this issue. I started off by having each person tell me a little bit about themselves and their experience working within the community.
Well, my name is Riel.
My name is Raiki, Raiki Adams, Adams.
I would like to describe myself as a community health worker, an LGBT activist with over 7 years of experience empowering communities, specifically committed to addressing health, housing, education, and food resource deprivation within the LGBT community and POC community.
I currently work as a HUD project manager for a local nonprofit here in Chicago. Prior to working at the agency I work for now, I worked in a housing program in North Carolina where we were involved with DOJ and working with persons in exiting mental health institutions and fighting for their rights to be integrated into the community, as well as working at a prison, a maximum security prison, as a correction officer in the state of North Carolina.
After introductions, I asked each person what burnout meant to them and how it has affected them and the people that they serve.
Burnout is just basically like an obstacle that gets in the way of productivity for an individual. And usually it kind of creeps up on you. So the person who's experiencing burnout usually they'll be the last one to know,
Right.
because it's like a slow type of integration.
I can specifically talk about my first role as a crisis intervention specialist of the organization. I felt that I immediately experienced burnout within the first 2 weeks due to the lack of support within staff. First off, I was someone who came from the population that I was serving, and the relatability pulled a lot of the clients in my direction, and which was overwhelming for a lot of different reasons.
I actually had official burnout maybe about a year ago. It was pretty bad. I had a lot of health issues, and I thought it was just, me being sick or just different things like that, my headache. But it was almost like my stress and my headaches were bad because of the work overload. And so the burnout was also working with my health condition.
So it was hard for me to find a balance to actually be there for them, and to be honest, even to find time that was respectful to their process. I was specifically there to intervene in crisis. So me having to see someone every 2 weeks due to the fact that I was the only person staffed that position, that became extremely hectic, and I was seeing probably 4 folks a day within 3 hours. And
Wow.
I felt that I was just swimming in a pond, but I could not escape.
when you're burned out, you are not able to fully give the job your holistic skill set. I could not be as effective with the job as I could have been if I had more time for just downtime to even debrief and prepare myself for the next person.
Those that are receiving services may not get the best of that person. It makes me feel kind of sometimes jaded. I've had participants who would curse me out, and I will be able to differentiate each person and know this is one person that doesn't affect everyone else. That's not how everyone else will, approach me.
Yeah. One particular time, a young person was they were into a fight, literally fighting. I had to grab the person and bring them out because they were dealing with heavy psychosis. Then go back into the space to try to get another person. So when it was time to intervene, it was like I was spread thin.
Switching over to some more solution-based questioning, I asked each person what they think we can do as service providers to help combat this issue.
I think, be more realistic with expectations. Like, the work doesn't stop, it just gets placed on other people. Being more open to, working together as a group and not looking at it like this is our problem, that's your problem, but we're a team overall.
I feel that we need to really start organizations. Everyone needs to start focusing on mental health. When you give it to a person and they're not able to sustain it, then you ultimately are making a setup. So I feel that we have more resources around healing folks. Give them the basic needs. Give them all of that. Give them everything they need there. But also figure out what that person needs spiritually.
Finally, I asked each person if they had anything to say to all our fellow community workers and young minds listening.
We think that self-care and going out to the beach is going to solve it, but sometimes it's really sitting down with your organization and really holding everyone accountable to make sure that we all are where we need to be when we come to work.
No book can define your experience. No one can literally tell you that you do not know how to define the person that you are.